The Community Nursing Practice Model Overview. Application to research and/or practice provided. The Community Nursing Practice Model, CNPM, has a variety of applications. For instance, it can be applied in research. Berry, Gordon, and Lange state that researchers and practitioners have applied the model to expand the scope of knowledge in nursing as well as nursing education. For instance, a nurse working in a distant area, where resources are scarce, uses the model to explore values and beliefs as well as the lives of females who are in recovery from SUD-associated issues. The nurse uses the principle of concentric circles to uncover health as well as socio-political and economic issues affecting females. Gordon and Dunn also report on the use of the CNPM model to analyze the vision of health literacy at a particular school. The model is holistic and detailed and, hence, enables researchers to focus on different aspects and look into different spheres of people's lives in connection with their health. Importantly, the model is also applicable in nursing practice. It enables nurses to provide high-quality services and, using the holistic approach, help patients to develop health literacy and effectively integrate into the community. Hence, people receive the necessary healthcare services, and they are also trained to address their health issues. Notably, it has been acknowledged that the use of the model contributes to the acceptance of change within the community, which is essential for the development of a better healthcare system. The concentric circles involve collaboration at different levels, including individuals, organizations as well as national institutions that have the power to implement a holistic change in the system. Theory strengths and limitations. Like any other theory, the CNPM model has its strengths and limitations. As for the major strength of the model, it is necessary to note that it is detailed and holistic. Thus, the theory involves such principles as nursing, person, community, and environment. These aspects involve all major spheres of people's lives and, hence, nurses can provide assistance that will address patients' major issues and concerns. Nurses will pay attention to all of the aspects in patients' healing process as well as the process of their integration into the community will be more effective. It is also noteworthy that the model can be used in many settings. The approach is especially effective in the research. At the same time, there is a serious limitation to the use of this approach when it comes to practice. The CNPM model requires quite substantial research that is associated with a significant investment of time. U.S. nurses are now overloaded with tasks and responsibilities, and they often lack time. Many nurses are also reluctant to make an additional effort and employ the model. Therefore, the model should also include certain details that will enable nursing professionals to utilize it in terms of their busy and overloaded agendas. Another limitation is the lack of details concerning concentric circles, especially when it comes to the circle of organizations with wider jurisdiction. It is quite unclear how nurses can actually communicate their concerns at this level. Of course, irrespective of the model's limitations, it is an effective approach that should be employed by nurses in their research and practice. They can also try to improve the model by adjusting it to the contemporary healthcare system that exists in the country.